I think it's really important when we're talking about, why didn't we catch this earlier, that, the whole point of this is not to feel guilty, is not to blame anyone, but to have the information to go forward and know what the signs are. Why didn't we find my dog's cancer earlier? Why did my cat's cancer spread by the time that I brought it to you, Dr. Sue? These are common, frustrating questions for both me and you, the pet parent, that we have about why do we often find cancer so late in dogs and cats. And that's what we're going to be breaking down in today's vlog. We'll be talking about why is cancer often found late, and we'll also be talking about why early detection is so important. It is one of the best ways that we can beat cancer. So we'll talk about some tips and which of the tests that we should be doing, how often, and things that we can do to try to find cancer earlier. Let's do it. Let's break it down. Let's start with blood tests, because a common question I get asked is there a blood test for cancer? It would be great if you could bring your dog in, bring your cat in, or if you and I could go to our doctor and they could run a blood test and tell us if we would have cancer. We would obviously want this test to be inexpensive, especially for our pets, because many of us don't have pet insurance, which I strongly advocate for. But we also want it to be accurate, right? So if they come back and say your dog has lymphoma, you want to believe it. You don't want a false positive. You don't want to be told your dog has lymphoma when they don't. And you don't want a false negative. You don't want to be told they don't have lymphoma if they possibly do. So the test has to be something we call sensitive and specific. So we really want an accurate test. And I'm doing this video in the age of COVID, and this has really become something that people are talking about, like, right? False positives and false negatives. So it would be great if we could have a blood test that would screen for cancers. And in people and in veterinary medicine, this is something that many companies are working on. I'm often told about different blood tests that are in the works, and sometimes some will be used. And then there was a lymphoma blood test for a while that was on the market. But as of now, there really is not a good, consistent blood test for cancer. Hemangiosarcoma, there isn't a good, test that you can just run blood work and find out if your pet has that cancer. So we're often left for different individual workups for your pet's cancer, and often your veterinarian or a medical oncologist, a cancer specialist like myself, is going to help make those recommendations and guide you through the process. There is a urine test right now for bladder cancer, transitional cell carcinoma, and prostatic carcinoma. And I'll put links below because I have a recent vlog about that. It's called the BRAF mutation test, the cadet BRAF mutation test. And that is a very sensitive and specific test that we can use for bladder cancer. But again, that's for one specific cancer. There may be more blood tests that will come out. But I don't want to say that blood work when you go to your veterinarian is not important, because let me say that the other way. Blood work is very important when you go to your veterinarian, because we can often pick up other things on blood work that may suggest that there is cancer going on that may lead to a workup. Sometimes there are things that we can pick up on blood work. For example, some lymphomas, specifically in dogs, will have circulating lymphoma cells, so we can see that. Some leukemias, chronic and acute leukemias in dogs and cats, we will see those circulating cells on the CBCs. Some animals with certain cancers will have high proteins, high globulins. We see that often with a cancer called multiple myeloma. Sometimes with liver cancer, the liver values can still be quite normal. Normal blood work doesn't always eliminate the possibility. So there's still plenty of reason why we're going to do blood work and a urinalysis, and why routine blood work and urine tests are often really important for the routine health and screening of cancer in your dog and cat. And I'll talk about in the next section, when I talk about going to your vet, how often I think we should be doing that. Okay, so the first thing I talked about was blood tests. So there isn't specific blood test yet for cancers, but we want to go to our vet on a regular basis and have a routine exam, and they will often do blood work. So what we call a minimum database, and that's usually a CBC, a complete blood count, a chemistry panel, which is going to allow us to look at the liver values, kidney values, protein, electrolytes, and a urinalysis. And that's what I consider a pretty minimum database. But what's also so important, and why I don't make diagnoses over the internet, is that physical exam where you go to your veterinarian, they get a weight. I'm going to talk about that in one of the upcoming sections, because weight loss is one of the common symptoms that we see with cancer. It doesn't only mean cancer, and I have another vlog about weight loss. It could be gastrointestinal disease, like inflammatory bowel disease, but weight loss is a common thing that we see with cancer. And as I talk about in that other vlog, my own cat lost cancer, and I and my husband, who's an internist, did not notice it because we live with our own pets, and it can be very hard to notice weight loss. And so often going to the veterinarian on a regular basis for weight checks can be a really important sign to, that they're losing weight. Obesity is also a separate issue. A lot of our animals are also gaining too much weight. So that's another way to make sure that your pets aren't gaining weight. But we're going to focus on weight loss. So how often should your pet go to the vet? So your pet should go to the vet by middle age, in my humble opinion, twice a year. Wow, really often, you're thinking. Think about how pets age. They age more rapidly than you and me. So by middle age, every 6 months is every couple of years for you and me. So I want them to be going to your vet for a good physical exam and some blood work and a urinalysis. And again, a lot of these cancers, if they can be caught early, are going to be more treatable, because hopefully we'll find them before they metastasize. Next thing is weight. Checking your pet's weight is so important. And as I talked about with my own kitty Jeter, weight loss is really hard to detect when we live with our pets. They're fluffy, it's really difficult. And their muscle mass and everything is hidden under all of this fluff, especially if you don't have like a greyhound or a Weimaraner or something like that. So it can be really difficult to detect weight loss in dogs and cats. And so part of that is, one of the symptoms is weight loss. So it's really important, even if you weigh them at home. So if you're able to, get on the scale at home, if you have one, pick them up and then do the math, that's a great way. Or you could invest in a small scale. I have had some clients that have bought pediatric scales and weigh their own pets at home on a regular basis. But with our Labradors, my husband will just pick up the dog, and weigh them, and we do the math, because we're often worried about weight gain in our dogs, because we know that lean Labradors live longer. Lean dogs live longer. So that's another way to help prevent, cancer and other issues, is keep your dogs lean. But again, monitoring your pet's weight is going to be so important for our dogs and our cats. So keeping an eye on their weight. If you can't weigh them at home, many veterinary clinics will be more than happy if you call them up and ask them if you can pop in on a regular basis. Many clinics will have dog scales in the waiting room, or they will be happy to help you get a weight, and they would love to see you on a regular basis. So set that up call your clinic and see if they'll help you get frequent weights as well. Early detection is one of the best ways to beat cancer. Some of the cancers are internal and some of them are external. For the external ones, I mean the ones of the skin and the subcutaneous layers. And what I am going to tell you is that you, the pet owner, are going to help us, the veterinarian, find these lumps and bumps on a regular basis. And if you have watched any of my vlogs, you know I'm a huge advocate of monthly lump and bump exams. And I have a whole separate vlog, I'll put the link below, vlog number 73, where I walk you through how to do a nose to tail lump and bump exam. And if you find, I have a program called See Something, Do Something, Why Wait, Aspirate. If the mass is the size of a pea, which is a centimeter, these are some of my caliper pens that I sell on my website. We also have these plastic calipers. And on my website, we have skin maps so you can keep track of your pet's lumps and bumps, so you don't have to remember, was it on the right or the left or the shoulder, where was it? So then you can go into your veterinarian with that skin map, but you can show them. So you're going to keep track of the lumps and the bumps. So let me repeat that. The mass is the size of a pea and been there a month. You want to go to your veterinarian for a simple aspirate. And that's where we insert a needle, collect some cells, and look at it under the microscope to determine if it's benign or malignant. Statistically speaking, more are benign than malignant. About 60% are benign in dogs. In cats, it's about the same, though some studies will say about 50-50 split in cats. And so what we want to do is find these lumps and bumps when they're small. And the majority, even the malignant ones, if we find them when they're small, can be cured with surgery alone because they're unlikely to have metastasized or spread. So, with these lumps or bumps, the frustrating ones are the ones that could have been cured with surgery, but they're too big because they're wrapping around the wrist, or they're wrapping around the hock or the ankle, or they're too big on the chest or the side of the dog or their cat, or on the neck, or involving the face, causing such, asymmetry and deformity and things like that. And if you think about a small dog or a small cat, the mass doesn't have to be too big before it becomes non-surgical. So it is really important that we catch it early. And I'm not blaming anyone, but the reason that I did this program is because I missed a lump or bump in my own technician's dog that was really big. We did get it off with margins, but it required a really big surgery with Smokey. And it reminded myself that we can all get complacent and we need to find these lumps and bumps early. So please check out Vlog 73 and help us help you find these lumps or bumps early. I'll say it again, most tumors, even the malignant ones, can be cured with surgery alone if we find them when they're small. So help us find them when they're small. I recommend at the top of the month when you're doing your flea and tick and heartworm preventative, mark it on your calendar. I have a great friend that I've met on social media, Rebecca Lee. I think she does it on the 14th of the month. So you just want to make sure it's on your calendar and you're doing your lump and bump exam. Don't be scared. They're not all going to be tumors, but we just need to find out what they are so we know what to do. Okay, well, that covers the superficial tumors, the ones on the skin and the subcutaneous tissues. What about the internal tumors? Because, how do we find those early? Because it is frustrating. Let's talk about the top 5 malignant cancers that we see in dogs. They're going to be lymphoma. Those you can feel the lymph nodes, and it's a really rapidly progressive cancer, but you can feel the lymph nodes under the jaw, in front of the shoulders, and behind the knees. And I'm going to put a link below to one of my most commonly watched videos about where are my dog's lymph nodes. Other common cancers that we see in dog are bone cancer, and things that you're going to look for are lameness. We're going to run through at the end of this video the top 10 symptoms of cancer. Mast cell tumors that you're going to help find by doing your monthly lump and bump exam. Hemangiosarcoma, that is commonly found in the spleen. And that's a hard one to find, right? Because it's an internal cancer. And the other one is oral malignant melanoma. And then another one that I'm going to throw on that list is mammary cancer or breast cancer. And you will find that in my lump and bump exam. I talk about checking the mammary gland area. Dogs have 10 mammary glands going from this area down back to by the inner thigh, and cats have 8 mammary glands. So it's really important, that you do the lump and bump exam, because that's going to help us find mammary cancer and mast cell tumor. Lumps will help us with lymphoma. But what about the internal cancers, Dr. Sue, like hemangiosarcoma? How do we help find some of these other cancers, like cancer that maybe, that's in the abdomen and things like that? So that is where I recommend that your pet get routine chest x-rays, radiographs, or abdominal ultrasound. What does routine mean? Again, going back to middle age, where I talked about that you're going to be doing your visits with your vet twice a year, I would recommend that's when you start doing your chest radiographs and your abdominal ultrasound twice a year, every 6 months. The reason to do that is to find, abnormalities early before they've spread, before they've metastasized. So that is my recommendation for chest x-rays and ultrasound. It's nice when they're younger, maybe 3 or 4, to do it once a year, just so you have that baseline. What is middle age? That will change, especially in dogs, because dogs age differently. Larger dogs, like a Great Dane, middle-aged is, probably around 3 or 4. For Chihuahuas, Lhasa Apsos, some of those smaller breed dogs, they have much longer lifespans. You can probably wait till 6 or 7 because they live much longer. So talk to your veterinarian, see what they, recommend in terms of when middle age is, but that is what I would recommend. For kitty cats, I think 5 to 7 is when you probably want to get your baseline one. 7 to 8 is when you're going to want to start to do it, in my recommendation, on a biannual basis. Before we talk about the top 10 warning cancers, I would be remiss if I didn't mention some of the top cancers in kitty cats. We talked about what they are in dogs. In cats, it's also lymphoma, but it tends to be gastrointestinal lymphoma, or involving the gastrointestinal tract and the organs in the abdomen, like the liver, spleen, and the lymph nodes there. We see an oral tumor, but it's not malignant melanoma like it is in dogs. It's a tumor called oral squamous cell carcinoma. I'm due to do a vlog on that one. And then we see mammary cancer, breast cancer, as I talked about in dogs. In cats, mammary cancer tends to be more likely malignant than it is in dogs and has a higher metastatic rate. So again, early detection is going to be very important. And in both dogs and cats, size is prognostic for breast cancer. So the smaller that we find it, the better the prognosis, meaning they live longer. So that is another good reason to find them when they're small. And then the fourth most common cancer that we see in cats are the soft tissue sarcomas, which is definitely on my list, one of the next couple of vlogs that I'll be doing. So those are the connective tissue tumors. Some of them are injection site associated and some are naturally occurring, and fibrosarcoma is the most common one of those. And last but not least, I would like to go over the top 10 warning signs that a dog or cat may have cancer. And I have 2 vlogs, and I'll put the link below, that go through these in much more detail. But I think it's really important when we're talking about, why didn't we catch this earlier, that, the whole point of this is not to feel guilty, is not to blame anyone, but to have the information to go forward and know what the signs are. So again, we can hopefully find cancer earlier, going forward. And I really think that that's important as well. And I also want to, suggest that if you have a strong feeling and you feel like you're not being heard, to go to your veterinarian and talk to your veterinarian. And sometimes I do get messages where they say, I don't feel like my veterinarian's listening to me. I just have a bad feeling. Then, it's okay to get a second opinion, whether that's a cancer specialist or another veterinarian in your practice, because you are your pet's advocate. You're their mom, you're their dad. And, sometimes I'm a paranoid pet parent and I'm completely off base. And I was like, oh my gosh, I got myself totally worried over something because I was freaking myself out. And it turned out that everything was benign and okay. We all do that. But sometimes your intuition is going to be correct. So, listen to your intuition, but don't get yourself too worked up. But talk to your veterinarian or talk to a cancer specialist. I have another vlog on, why you might want to go see a specialist. I also offer a consulting service for your veterinarian if you would like your veterinarian to consult with me or one of our other specialists at Fido Vet. I don't do consults with pet owners, but I do offer that for other veterinarians. So we'll throw those links below. Lots of links below. Okay, but what are the top 10 warning signs that your pet may have cancer? And remember, not all of these mean your pet has cancer. Other things can cause these as well. And we've talked about some of them. So, weight loss is one of them. Changes in appetite. And lots of things can cause changes in appetite. Kidney disease, liver disease, just so many other things, gastrointestinal disease, so they can just have an upset stomach, but it can also be cancer. So changes in appetite, weight loss, sometimes weight gain, but usually weight loss. Changing or enlarging lumps and bumps. And we talked about the see something, do something guidelines, mass of the size of the pea, been there a month. And again, lymphoma falls into those lumps as well. Sores that don't heal. So sometimes these lumps or bumps are ulcerated. That would be another reason to go see your veterinarian. Lameness is definitely something. So we think about osteosarcoma. There are also some other cancers of the bone as well, but osteosarcoma is the most common primary bone cancer. And there are some cancers like bladder cancer, breast cancer, prostate cancer that can spread to the bone as well. So again, any persistent lameness, that would be something that you would want to follow up on your vet. And definitely in the large and giant breed dogs where osteosarcoma bone cancer is more likely, check out the vlog for more information on that. So any odor or unpleasant smell, bleeding from the mouth could be a sign of oral cancer, could also be dental disease. But again, reason to go to your veterinarian and make sure they get that oral exam. Talked about oral malignant melanoma. I have two new vlogs on that for dogs, and squamous cell carcinoma for kitties. Difficulty breathing, difficulty eating, difficulty swallowing, that's a common symptom. Difficulty urinating, which I mentioned bladder cancer. Difficulty defecating, that could be something associated with the gastrointestinal tract, or even a lymph node or something that is blocking. Prostate cancer can actually cause difficulty defecating as well. Bleeding or discharge from any opening, so mouth, nose, urinary tract, anus as well. So defecating, if you saw any blood from any one of those areas, you would want to go to your vet. And then a persistent cough as well. Other things cause cough, other respiratory diseases. But again, primary lung cancer, which is much less common than cancer that has metastasized to lungs. But go to your veterinarian, let them do an exam. They're probably going to want to do chest radiographs. All right, guys, that was the top 10. Again, there's much more information in those two vlogs. We'll put a link below. There's 5 of them in one vlog, and then the second vlog has the other 5. And that wraps up this vlog on why we didn't find my pet's cancer earlier. I hope it was helpful. I know this is tough. It's really tough when your pet was diagnosed with cancer and you wish, I just wish I did something differently. And I'm often someone that looks back on what I do and I question myself. So I want this to be a positive vlog, something educational, and I really hope that that's what it was. I'm gonna ask you to leave comments, let me know. I look forward to seeing you at the next video, and thanks so much for watching.